I'm Dr. Adeel Memon. I'm the consultant orthopedic surgeon here in Meta Private Network, primarily based in Cork. I joined Meta Private Network back in 2020. So I was trained on the Irish Higher Surgical Training Program in trauma and orthopedics. That starts with the basic surgical training, went across most of the hospitals across the country, and then the Higher Surgical Training Program was based between Cork, Dublin, Waterford. I completed that program in 2018, at which time I did my fellowship at the Royal College of Surgeons in Ireland as well. And then I took fellowship training in arthroplasty, primarily focusing on hip and knee replacements and disorders of the foot and ankle. The first fellowship was in New Zealand, in Dunedin, with the University of Otago, and that was a year-long fellowship. And then I came back to Newcastle in the UK to did my foot and ankle fellowship before I came back to join Cork in 2020. I treat most of the disorders affecting the lower limb, including joint replacements for hips and knees. And my subspecialty interest otherwise is also around the foot and the ankle. And so I'm one of the very few surgeons in Ireland who would offer total ankle replacement as a form of treatment for ankle arthritis, for example. The concerns that the patients would have often will be dictated by what kind of condition they present to me with. So say, for example, if somebody comes in with a bunion disorder, say for example, and they want to explore their option of reconstruction, one of the main problems or main concerns they would have is how long will it take for them to recover from this. All the patients who undergo any surgical procedure will be given information on the day before they go home about their post-op appointments. Usually is given to them before they leave the hospital, so they know exactly the time, the day that they will come back to me. They have a contact number for both the ward as well as my office to contact us if they have any issues, particularly around the wound or around prescription or pain relief, etc. And then further treatments such as physiotherapy will be arranged for them in the clinic.